Now, the number of COVID-19 infections keep going up with every update, and in some places, it doesn't seem to be slowing down. Strangely, this is happening at a time when the world is gradually opening up for economic and social activities. Although the openings are done with caution and warnings to abide by the safety rules, the rates keep rising. The U.S. hits about 5 million. It hits a 5 million mark of COVID-19. And sure enough, it is a cause for concern. We will be looking at that tonight, but right after the current statistics. The global figure of infections currently stands at over 19.8 million. The death cases have gone over 731,000, and the recovered cases are over 12 million. That's 12.1 plus. In Nigeria, the NCDC reports that 46,577 cases are infected, or people are infected, while the death cases are 945, and another 33,186 people have recovered. The U.S. still remains number one of the top 5 countries with a large number of infections. It has a little over 5 million infections. Brazil is second with over 3 million infections, and then India with over 2.2 million. Russia is inching towards the 900,000 mark, and South Africa has over 500,000 infections. This is COVID-19 Myths and Facts. Welcome on board. So here are your daily COVID-19 tips. Are you pregnant and COVID-19 positive? Here's how to protect yourself and the unborn baby. First, you need to wash your hands regularly. Practice physical distancing with others and avoid touching your eyes, nose, and mouth. Cough or sneeze into your bent elbow or tissue. If you have a fever or difficulty breathing, seek medical care early. Call beforehand and heed to your doctor's medical advice. Now, for nursing mothers with COVID-19, it is advised that you practice respiratory hygiene and wear a mask. Wash your hands before and after touching the baby. Clean and disinfect surfaces routinely. If a nursing mother with COVID-19 is too unwell to breastfeed her child, she should be supported to explore other means, including expressing milk, relactation, and donor human milk. Of course, these tips are courtesy of the global health body, the World Health Organization. In the last 2 months, 7 U.S. states, including Arizona, Arkansas, California, North and South Carolina, Tennessee, and Texas, have reported record highs in coronavirus hospitalizations.
California is now the 3rd U.S. state to report more than 10,000 deaths from the novel coronavirus, a grim reminder of the mounting figures from the country with the highest number of COVID-19 cases in the world. Florida trails with 533,000. Texas follows with 508,000. New York has 426,000, while Georgia has 200,000 cases. This comes on the heels of President Donald Trump's announcement of several executive actions, including $400 weekly to provide economic relief to hurting citizens. In spite of these relief measures, there's no immediate end in sight to the rising COVID numbers, particularly because of open disobedience of scientific guidelines. In South Dakota, tens of thousands of motorcycle riders reportedly gathered for a rally weeks ago where physical distancing was a rarity. The governor of California has also condemned citizens who visit beaches brazenly for flouting COVID-19 guidelines. Religious gatherings have also been known to fuel the flouting of COVID-19 guidelines in the United States. While some religious bodies are said to be finding innovative ways of continuing worship, others are holding meetings with large numbers of persons and thereby staring safety concerns.
Joining me via Skype is Oisa Daba, a journalist with Africa Related, resident in New York. Thank you so much for joining. It's good to have you joining. So, well, you are in a place where the numbers are rising. The U.S. has hit the 5 million mark, slightly over 5 million. How compliant are people to use face masks and other, safety guidelines?
Well, it depends on who you talk to and who you ask. A lot of people have taken to these advice that's been given by the CDC and also by state government to comply with social distancing and the wearing of masks and the washing of hands. And a lot of people have, but you also have places where, like your report says, it's just clear defiance and flouting of these orders to the point where the executives or there's no policing around this type of behavior other than to resolve to what some of these state governors have and mayors have resolved to. Which is shutting down some of these public places and shutting down some of these parks. People do refer to their constitutional rights to not wear masks, which is okay. But when you look at it in the context of the pandemic, which is what we're talking about here, it is not only about your individual safety. The message really has to be drilled in that it is really about the safety of the general public.
Okay, so a couple of, was it last week or sometime back, we had Stella Emanuel, with a couple of doctors who had a press conference which went viral. Now, it was on hydroxychloroquine. Could that have been fueling the current liberties and blatant disobedience of scientific recommendations?
I don't think it's fueling it. I think it's part of it. It's part of the discourse. Like I said, you have both sides and both sides talking about what they think they know best. And it's really, the onus is on us to listen and for public knowledge and public advice to be out there. It's just for the public to listen and also to comply. No doubt that videos like what Dr. Stella Emanuel put out had an impact of some sorts, whether she was coming from a political background in supporting the current president and his administration, or whether she was coming from the human angle of recommending a drug that she found helpful. Whatever her motives are and whatever her intentions are, she did put out something out there that stirred some form of controversy and also stirred some form of discourse. And it's also about patterns. I've heard so many sides to this this video that went viral, but it's also about taking the necessary precautions so that we don't put out misinformation out there. In all our professions, in this time, I think we all have to be extremely careful about the type of information that we put out. It's got to be verified, and it's not just for journalists, it's also for medical professionals in wherever you find your voice, because there are people following you and there are people listening to you. And if you do put out wrong information out there, the consequences could be.
Let me throw this in. It's ironic that at the point where the world is gradually opening, schools and religious houses and other places are opening, is at the point that the numbers are going off the roof. What do you make of this, and how would you advise for this to be contained, controlled, and cautioned?
Interesting, because in these parts it's summer. People have been cooked at home for months on end, with the winter passing, and also, the sun has finally come out. So you find that you find the reason for this kind of behavior is further escalated by the change of weather. People want to go out and enjoy themselves. People have had a very difficult 2020, and you really don't blame them. But if you do have to be out, is what matters. France, for example, we can take cues from Europe, which is going back to shutdown mode again, gradually, and reinforcing some of these things that were initially enforced and later on relaxed, and now we can see it being reinforced again. So there are patterns to follow. New Zealand is celebrating their 100 days of no domestic transmission. So there are countries that we in the U.S. and countries worldwide can look at in terms of how their pattern has.
Okay, Oiza, I wish we could go on, but I need to cut you off now because it's time to go. Thank you so much for being a part of the show. Oiza is a journalist with Africa Related based in New York. Thank you so much. And there you have it. Without a doubt, there is need for caution, given the circumstances, especially as the economic and social activities are beginning to pick up across the world. We have the guidelines to abide by and for all to stay safe until we find a vaccine. Thank you so much for watching. Do take good care and stay safe.